Hello, my name is Ashley Stewart, student of Occupational Therapy at Trinity Washington University, and this is my friend Jane Weil, who will be acting as my patient today. We will be demonstrating how to measure range of motion of 4 joints of the body. Range of motion is defined as the amount of movement possible at a joint. We will measure both active and passive range of motion, so active range being the muscles that act on that joint are responsible for the movement. Passive range of motion being an outside source is responsible for the movement. In this case, the therapist or the therapist in training. We will also be demonstrating how to grade muscle strength using the manual muscle testing technique, both using gravity and also in a gravity eliminated position. We will begin with shoulder external rotation, which is this movement right here, and functionally you can think about reaching back for something behind you, particularly when you're putting on your jacket to go outside in the cold weather. So for shoulder external rotation, we'll use a goniometer and we'll have the patient seated and neutral, sitting up nice and tall. I'll ask the patient to bring her arm out to 90 degrees here, so the humerus is abducted to 90 degrees. And also her elbow will be flexed at 90 degrees. The forearm is pronated with the palm facing the floor. So the fulcrum of the goniometer will be placed right here at the olecranon process on the elbow, and the stationary arm will stay parallel to the forearm. Well, it's now parallel to the forearm, but it will remain in this horizontal neutral position parallel to the floor. The movable arm will follow the forearm up and actually measure the angle of the joint range of motion. So for active range of motion, I'll show the patient the technique of raising the arm, and then I will ask her to raise her arm up as far as she can go. Okay. Keep it out here. And we'll measure her here at 74 degrees. So back to 0 to passive range, we'll come back to that neutral position. Again, fulcrum is placed on the olecranon here. I'll once again ask my patient to raise her arm just as she did before. And is that as far as you can go? When she gets as far as she can go, I'll then continue to try to move her a little bit further. And we've got 79 degrees. So we'll note that normal range of motion for shoulder external rotation is 0 to 90 degrees. Her active range was, we were able to get to 74 degrees, and her passive range we were able to push all the way back to 79 degrees. So moving into manual muscle testing, because she was unable to move her arm through shoulder external rotation through the full range of motion, I would automatically bring her to a gravity eliminated position. However, for the sake of this video, we'll demonstrate using gravity and then we'll turn to the gravity eliminated position. So for the prime movers of shoulder external rotation, we'll come to the same position, bringing the humerus out to 90, flexing elbow to 90, and pronating forearm palm facing the ground. I'm going to stabilize right here proximally and apply resistance here distally. I'll demonstrate again. The movement will be this, and I'll ask you to move your arm and don't let me move you while I apply resistance. Ready, set, go! Pretty strong there. I will grade her at a 4. So for manual muscle testing, again for the prime movers of shoulder external rotation, the patient will be lying prone on a table, or in our case a bed, and you can roll up a little towel or blanket, whatever you have around, and place underneath of the humerus just for comfort and to keep the humerus really in line with the joint. Again, her elbow is bent to 90 degrees. I'll stabilize proximally, and I will apply pressure again on the distal forearm next to the wrist, and I will ask the patient again to move her arm forward. Don't let me move you. and we'll grade her there at a 2+. So on to our second joint movement, which is elbow flexion. Looks like this, functional movement. Eating, feeding yourself, bringing a glass, in Jane's case, glass of wine up to have a sip or a glass of tea.
Yeah.
So in this position, again, she'll be seated. And because in this class we reference elbow flexion normal range to be 0 to 150 degrees range, I'm going to start her with her arm all the way down towards the ground in full elbow extension. The forearm at this point still will be supinated. So the fulcrum of the goniometer is going to be placed on the lateral epicondyle right here at the elbow. The stationary arm is going to remain parallel with the humerus. I'll bring the movable arm all the way down. It's going to remain parallel to her radius through this entire range. I'll demonstrate the motion. Is going to be bringing your hand up towards your elbow, and then I will ask Jane to bring her hand up, or hand up toward her shoulder, excuse me, and you can go ahead and do that now. Now when measuring elbow extension, sometimes the fulcrum can move away again from the lateral epicondyle, so you just reposition to make sure your measurement is appropriate, and I'm getting her there exactly at 150 degrees. Now we'll bring it back down for passive range. I'll do the same exact thing. I'll ask her to bring her arm up as far as she can. And then I'll see if I can get a little bit more, but she was already at full range, so there we are. And we got to 151 degrees of range of motion for elbow flexion. So now that we know that she has full range of motion for elbow flexion, we'll manual muscle test the prime movers of elbow flexion. So I'm going to stabilize proximally right under the elbow. I'm going to apply resistance on the ventral side of the distal forearm right next to the wrist. I'll ask her to do that same exact motion. Move your hand towards your shoulder and we'll see who wins. Ready, set, go. And she's very strong. I'm going to grade her at a 4+ for gravity limited MMT of elbow extension. We would abduct the humerus out to 90 degrees. We'll imagine here that her arm is resting on a table. My hand will take the place of the table. For now, we'll turn her thumb to face the ceiling. And once again, we'll in a gravity eliminated position, we would see if she could do that full range. So do that motion, bringing your hand towards your shoulder. And so she has the full range. So then I will know that I can apply resistance, again, right here distally and stabilizing proximally. And ready, set, go. And as strong as she can be there, I will grade her at a 2+.
It's all ever be.
So for forearm pronation, the patient will be seated. The humerus will be adducted to the side, so you can just instruct the patient to hold their arm in towards their side. The elbow's going to be bent at 90 degrees, and the arm will be in neutral, so neither pronated or supinated, but the thumb will be facing the ceiling. So I'm going to hand this patient a pencil, and they're going to hold it towards their thumb over here. Again, neutral position. The fulcrum of the goniometer is going to be placed right here at about the third metacarpal next to the knuckle. So the stationary arm is going to be perpendicular to the floor, and the movable arm will follow the pencil and will measure in a line parallel to the pencil. So we'll instruct the patient to turn their palm towards the ground. Measuring again the movable arm in a parallel line to the pencil, measuring her right there at 90 degrees. So for passive range, she is already at, I'll note the normal range of motion is between 0 and 80 to 90 degrees. So she's already got the full range of motion. I'll see if I can get her a little further in passive range. So again, we'll start out at neutral, placing the fulcrum here next to the third metacarpal.
Now what do you want me to do?
And we'll do the same thing. I'll ask you to move your arm or move your palm to face the ground as far as you can go.
I can keep going.
And we'll see if she can go without moving the wrist, just the arm, and bring your elbow back in towards your side. Perfect. And we'll see if she can go just a little further.
I got this damn pen.
Measuring her just a little over at about 91 degrees. So for grading muscle strength of the muscles that perform forearm pronation, will again be seated. The elbow will be in towards the side, so the humerus is adducting here. If the patient is unable to keep that elbow in, you'll need to stabilize and use a one-hand technique for manual muscle testing. If they are able to hug that elbow into the side to avoid the humerus abducting, then you're able to use the sandwich technique with both hands. So we've gone through this. She's able to hold the elbow in. We'll just ask her to move through that full range of motion here for pronation, which she's able to do. So now I know I can apply resistance. So again, with the forearm supinated, I'm going to sandwich the arm, and I'll ask her to perform that movement again.
Well, you're pinching my...
And she is very strong, and I'm going to give her a 4+ for that. Moving to a gravity eliminated position, she is able to come to a side lying if your patient does need to, requires coming to a side lying position. For this, we're going to bring her humerus out and rotate her elbow into 90 degrees of flexion here. Now that we're in a gravity eliminated position, I'm again going to see if she can move through that range, so moving your palm away in that direction. And I'm stabilizing here. You could have the arm also resting on a table if you had a table. So here she's able to move through the range in the gravity eliminated, so I'm going to apply resistance here and ask her to move that same. And again, I will grade her at a 2+. Okay, so for measuring the distal interphalangeal joint here on the index finger, we're going to place the fulcrum right here on the joint. We're zeroing out the goniometer. I'll show you in this direction here for the sake of the video. And I'm just going to ask her to start to bend her finger. Following with the fulcrum staying on that joint, I'll measure her there.
Where'd it go?
At 65 degrees. For passive range of motion, we'll come back to the same scenario here. I'll once again, ask her to start to bend her finger. So you can bend as far as you can go. It's okay, it'll move a little bit and I'll keep following you. And then I'm going to see if I can actually push her into a little bit further through passive range of motion. And I'll get a measurement there at 75 degrees. So lastly, for grading muscle strength using the MMT for the motion of DIP flexion, we'll have the patient seated and their arm is supported on a table. So at this point, I'll ask the patient to move bend their finger through range of motion to see that she has it. Now I know that I can apply resistance. So I'll be stabilizing right here at the PIP joint and applying resistance right here on her distal finger. Again, I'll ask her to move her finger, bend her finger back. Very strong. I'm going to grade her there at a 4. If she was not able to move through full range of motion there in the gravity against gravity position, we would move to the gravity eliminated position, which is just having the wrist there at neutral. So from here, we'll ask her to extend her finger out, bend her finger, see if she can move through the range, and she can. So I'll be stabilizing here to feel for palpation, and I'll be applying resistance towards the direction of extension right here. And once again, I'll ask her to bend. So bend your finger, bend your finger this way. Perfect and strong in the gravity eliminated. I will grade her at a 2+.